Hi there. I'm going to do a brief overview of our environmental health PowerPoint. Let me pull that up for you here. I've noticed on my YouTube channel that there haven't been a whole lot of views on my recent lectures. So that may be because you're finding that you don't feel the need to listen to more explanation and that you're able to get what you need from the PDFs that I post, which is fine. So what I'm going to do is just really briefly go over key points of this, and then I just expect for you to make sure that you understand the fullness of this lecture and click on all of the links that are listed as well, and I'll kind of explain what they're for. Um, I love starting this lecture with this Bible verse from the Message version of the Bible. So I'll read it for you here. I think it's just a beautiful reminder of what we're studying when we think about environmental health and how we need to remember that this is God's creation that we are attempting to honor and our health within that. So this Bible verse in Psalm 19 says, God's glory is on tour in the skies, Godcraft on exhibit across the horizon. Madam Day holds classes every morning, Professor Knight lectures each evening. I love that personification of day and night, and how this is just sharing that we can learn so much from our environment and nature around us. The definition of environmental health from the Institutes of Medicine is listed here. I won't read it for you. It's pretty straightforward. Just want you to be familiar, for those of you who are visual learners, this may be a helpful tool for you to see how environmental health fits in the big picture of public health that we've been talking about all semester. The center of this kind of half circle talks about individual factors that make up a person's health, things that you're used to learning in your sophomore and junior year of nursing school. And then the greater things have to do with social determinants of health, which is a common theme threaded throughout our course. And within that big picture, the purple outline is environmental conditions. So how are we working to make sure that people have the best chance possible to have health when we're looking at the places that they live and work, play, etc. So Healthy People 2020, I know we're going to Healthy People 2030, but for Healthy People 2020, so for the last decade, you know that they have set out of a whole wide variety of objectives for how we can achieve public health in different categories. I've pulled out just a few here in related to environmental health. That's the EH at the beginning. There are plenty more related to environmental health, but a few that we'll cover in this lecture and in this class have to do with blood lead levels in kids, pesticide exposures, toxic pollutants, indoor allergens, and lead-based paint. So these are just a few of the ways that our government has acknowledged that we need to do a better job of improving our environmental health. Just to make a few connections, you remember Lillian Wald, the mother of public health nursing, who did a whole bunch of things in the early 1900s in New York City. And one of those was focused on improving the environment for kids. If you remember, her and her colleagues were the first to develop a playground that was dedicated to kids with special needs. They were also big on taking kids from these immigrant, poor families on the Lower East Side. They would take them on field trips to the countryside. So they were considering different ways to improve a child's access to green space, which studies have shown improves a whole variety of physical and mental health outcomes for people throughout life. If you remember from that awesome video we watched very early in the semester on the upstream approach, the woman that kept coming back into the ER, into primary care with all sorts of headaches and sinus symptoms, it ended up that she just had indoor allergies, that she was living with a really bad mold problem that she wasn't aware of. And so if you also remember from that physician in that TED Talk, he says, health begins where? Where we live, work, play. We just talked about social determinants of health. There are so many things that we can look at within the environment that affect our health. Genetics has a role to play. It's not something that we've talked about extensively in this class, But alongside the Human Genome Project, where there were scientists mapping all of our genes, there are also scientists involved in an environmental genome project where they are mapping all of the different genes that we have that respond to the environment. So basically, this kind of leads into the whole science of epigenetics, which I find incredibly fascinating, which is where we can see which genes actually are turning on and off based on environmental factors. Something that I've been looking up with my husband. As you know, my oldest son was recently diagnosed with not only type 1 diabetes, but celiac disease. And I grew up on a farm. My dad he just retired, was a grape grower and used a lot of pesticides throughout his farming. And that was right where I lived. And my husband and I have been able to find recent studies that have looked at epigenetics related to pesticide exposure and the links to celiac disease. So I am now wondering, is my own pesticide exposure, did that affect my genes? Did I then pass that on to my child who developed celiac disease? So it's a really interesting, there's no clear answers for that, but it's a really interesting avenue of science right now that's looking at environmental health related to genetics. Epidemiology, something that we talked about also early on in the course. When we look at surveillance, surveillance is where we're constantly gathering data about certain health conditions and trying to understand who's most at risk, where those cases are often happening, what are the potential exposures or things that put people at risk. So one way that we do that in the state of California, and that's what this childhood-led registry link is our California Department of Public Health website. And there's lots of resources for families and healthcare providers to understand how we in the state of California mandate blood lead levels in children before they enter state funded either preschool or kindergarten. Every single kid in California has to get their blood lead level checked. And then this information is sent to our state so that we can monitor this public health concern for kids. Your reading for this week also kind of goes into the details about what to look for, signs and symptoms, what to do. And so I want you to be familiar with that because the CDC has identified this as the hugest public health or environmental health concern for kids is blood lead levels. Another thing related to epidemiology and environmental health is using geographic information systems. So the link there is to a really helpful article that talks about the different ways that geographic information systems are used. And basically this is using technology to pull demographic data from people and then map that. So that again, we can see on a map view where certain health conditions are occurring and then begin to identify how we can help those individuals best. So you were able to use some of the San Diego County data related to Hep A in your epidemiology team activity. That's exactly what this is GIS. Another way that we're obviously doing that now is with coronavirus case and death tracking. And there's daily maps updated for states, for counties, for the world to look at where cases are happening the most, where deaths are happening the most, etc. I'm not going to go over all of the details here, but I do want you to read this. It's pretty straightforward and understand that this is a significant environmental health concern because if not caught early on and treated, while lead poisoning is treatable in early cases, if not caught soon enough, it can lead to neurodevelopmental problems, delays, and potentially death. So briefly, I'm going to just go through different environmental health concerns related to air, food, and water. There are so many more, and that's what your team discussion board is for this week, is to explore more specific examples that affect our daily lives. But I just kind of am throwing blanket things up here as to concerns related to air pollution. I want you to be familiar with AQI, that stands for Air Quality Index. It's a way that the Environmental Protection Agency, one of our federal agencies, is able to track on a daily basis the air quality level. And you can look up the AQI for pretty much any city in the world to get an understanding of how good or how bad that air quality is. This would be especially important for people with asthma, as you can imagine, or other lung conditions. If you click on this link here, CDC's environmental health tracking tool, it's a fabulous and fun interactive website where you can type in a city, a county, or a zip code, and you can get all of the most current, sometimes it's a few years ago, but the most current information related to where you live about all sorts of factors related to air pollution, related to the amount of people that smoke, the amount of days of excessive heat within a given year, water quality, all sorts of things. So it's a fabulous website to use and to share with others. And then at the bottom of this is a link to the National Library of Medicine's website called Talkstown. This is a required resource for your team discussion board this week, and it just has a wealth of resources related to all sorts of diseases and health conditions linked to environment, and then different chemicals and types of exposure, and just gives you the latest science and all of that. And it's not just for healthcare providers, it's also easily accessible to lay people as well. These are things related to issues with water, which is currently listed as the biggest global health issue, is the lack of safe drinking water. And then there's lots of issues related to food. The link for food additives takes you to the other required resource for your team discussion board, which is the Environmental Working Group's website. And they are a fabulous nonprofit organization, advocacy organization that does a lot of research at harmful chemicals, harmful foods, harmful food additives, etc. So that is a great list there. If you're not familiar with the concept of the dirty dozen, the EWG, Environmental Working Group, has a lot of resources for that, but basically it's the list of the top 12 foods that you should try hardest to buy organically because they are most likely to absorb pesticides in the soil. So mainly referring to fruits and vegetables. And then when we think about not just our own individual harm, but when we think about the harm on our planet, we can look at different kinds of things. So this is just a really helpful graph to look at how much water it takes to grow, produce, and ship off different types of proteins. So the top is listing it by protein and the bottom is listing it by calorie. So you can see, like, you know, the effect it has on our world when we consume different types of protein. And definitely sheep, beef, goat are not so great when you look at the water footprint. And then this next slide is looking at the carbon footprint. So how much carbon does it take to produce and transport all these different types of foods, mostly protein, but not all protein. There's some other nuts, broccoli, tomatoes towards the bottom. But again, sheep and beef are not so helpful for our environment. They take a lot of carbon. Part of your viewing for this week is this video linked here, and I also have it linked in Canvas under required readings and videos. This is about a 20-minute TED Talk type video. It's not an actual TED Talk, of one of the leaders at Environmental Working Group discussing some pretty interesting policy and science related to environmental health. It's fascinating. I think you'll really learn a lot from it. I will also post a link to kind of a handout that we usually use in class that's like a Word document that you can fill out, so kind of keeps you taking notes while you're watching the video. This is part of your reading, so I'm not going to talk about it here, but I prepare as a mnemonic that is widely used in nursing related to environmental health. So it's basically a way for you to remember the kinds of things to ask your clients when you're looking for potential exposures within the environment that are affecting their health. So I've just listed the mnemonic and then different types of questions that you might ask related to each category. Ultimately, we have a variety of roles to play in environmental health as nurses. We can get the community involved. We can organize public forums. We can get people talking about and just getting the word out there about potential exposures within their own specific communities, because each community is going to have different exposures, whether they're living close to industrial pollution, like big industrial plants, whether they're living close to freeways, whether they want to advocate to make sure that elementary schools are not placed close to freeways or placed close to liquor stores, or, there's a variety of things that could be dangerous in the environment. We already talked about assessing either the individual, or when you're assessing the population, that's when you're looking at geographic information system data, when you're looking at the mapping. Epidemiological investigations use that GIS data to look at specifics. So when I had that link earlier for GIS, there was an article talking about how different groups have been able to see different types of cancers in certain regions that are like popping up in hotspots. And then they're able to find that those hotspots are actually people who live downwind from farms that are heavily sprayed with pesticides. And so they're able to make some connections there. So that's just one example of epidemiologists that are doing good work in environmental health. Policy development. So something that may be very interesting to you is that there are a lot of ways that we are actually putting our patients at increased risk in the hospital with environmental exposures. And one of those is that many of our healthcare products that we use in hospitals actually contain mercury, which can be extremely harmful to people. So I have this link. This is an international organization. I'm going to show you this, Healthcare Without Harm. Fabulous organization. I have it already linked to the US and Canada site. I think you might find this fascinating to see a list of potential items in a hospital that potentially have mercury in them. So you click there, it links you to a PDF. Look at this. Doesn't mean that for sure these items have mercury in the hospital that you're in, but it's a possible and something that you might want to ask about, such as alarm batteries, defibrillator batteries, different sorts of lamps, GI tubes, thermometers, all sorts of things. The list goes on and on. So just have that for you there. I think it'd be important for you to take a look at that. And so getting involved policy-wise would be to making sure that there's a campaign going in your hospital that makes sure that we are avoiding the use of extremely toxic chemicals, like for example, for cleaning when possible. That may not always be possible, but when it is, and also making sure that we are not bringing in items that contain mercury when we can find mercury-free items instead. And I end with this quote that I think is also beautiful in just recognizing that we play a small role in the much bigger picture of environmental health, and yet everything that each individual does affects the big picture. Whatever befalls the earth befalls the sons of the earth. Man did not weave the web of life, he is merely a strand in it. What we do now has a huge impact on generations to come regarding individual health and the health of our planet. That is all I have for you today related to environmental health. Please make sure you check Canvas for the assigned readings and for the PDF of this PowerPoint.